Hello everyone, and welcome to this episode of Lifestyle Matters. And once again, we have the good Dr. Saveena with us. Hello Saveena, how are you?
Good, thanks Ferghal, and yourself?
I'm very well. So I thought today we would talk about the DASH diet. So what does DASH stand for? What does it mean?
Okay, so it stands for Dietary Approaches to Stop Hypertension. That's it.
Right. So basically, it's very simple. It's entirely focused on reducing blood pressure, isn't it?
It is. And it's what lots of GPs, lots of doctors actually recommend all the time. You know, when you've been diagnosed with hypertension, let's talk about the DASH diet. Well, yeah.
Let's talk about the DASH diet because it stops hypertension. That's what it's for.
That's correct.
So what's in the DASH diet? You know, what is it? Is it steak and chips, burgers for lunch?
Oh, Ferghal. So the DASH diet is something that we recommend quite commonly when someone's diagnosed with high blood pressure. It is what's in the current guidelines by the American Heart Association. The emphasis is really on eating a diet high in potassium, magnesium, calcium, lots of fruits and vegetables, whole grains, and fish, poultry, things like that, and having lesser amounts of salt in our diet. Now, the average individual usually consumes about 2,000 milligrams a day of salt a day, which is about a teaspoon of salt. Sorry, no, that's the current guideline. But what we are actually taking in is about 9 grams, which is where the recommendation is actually a 5-gram intake. So we are actually almost double of our current intake. Yeah. Now, and
that's a really important point to understand, isn't it? Because we just don't appreciate how much salt there is in processed foods. And, you know, one of my favorite processed foods is pizza. Mm-hmm. But that's probably the most salty food that you can eat in the Western diet. You know,
and we don't think about
how much salt there is.
Definitely. And even things like, you know, when you talk to people, or what do you snack on? A handful of nuts, or, you know, things like that. And you ask them, is that just raw nuts? Is that roasted nuts? And you don't think about the amount of salt that's all put into that when they're also roasting it. So it's just lots of hidden salt in our diet, I guess, which we aren't quite aware of. Yeah. So I guess this study kind of looked at, to put it very simply, what they found is people who were consuming lesser amounts of sodium, of salt in their diet, had a blood pressure reduction happening. The lesser we consumed, the bigger the reduction. So, for example, if most of us consume about 3.5 grams a day of salt in our diet, if we reduce it to 2.3 grams a day, our blood pressure can reduce down to 7 millimeters mercury, which is quite a good number. And this is just a number in someone who doesn't have high blood pressure. If you have high blood pressure, that reduction is even greater, which is about 11.5 millimeters mercury. So it just goes to prove that salt, a high salt diet can increase our blood pressure even more.
Yeah, because a reduction in salt reduces the blood pressure. And we know that the DASH diet has a bigger effect in people who are already diagnosed with hypertension rather than someone who doesn't have hypertension to begin with.
But why all the fuss about blood pressure, Ferghal?
Well, why all the fuss? Well, basically, if we don't treat high blood pressure, if we don't treat these numbers, then people develop downstream diseases, right? Now, a lot of people say to me, "Oh, well, I feel well." Hypertension is a silent killer. You don't notice your blood pressure going up until it's almost too late. So by the time you get headaches from genuine hypertension, you really got to the point where you need almost emergency treatment for your hypertension. But over time, as we become more hypertensive, as the pressure builds up in our vascular system, we increase the risk of heart disease, stroke, peripheral vascular disease, which leads to amputation. We increase the risk of kidney disease. We increase the risk of eye disease. These are all potential complications of having high blood pressure. And then, I suppose we need to also understand that as we get older, hypertension is one of the big determinants of whether or not we're going to have cognitive impairment in our old age. So, all of the great guidelines about cardiovascular health and cerebrovascular health and cognitive health, they all emphasize blood pressure reduction. And the thing about blood pressure reduction, the optimal time of managing this blood pressure is not actually when you've got the disease. It's 20 years beforehand when you're still relatively young, fit and healthy, but your blood pressure is creeping up. So the investment in your numbers in terms of effort to actually reduce the numbers and make sure you're in the normal range or in the target range in your 40s and 50s will pay dividends into your 70s and 80s. And the corollary is also true that if you ignore these numbers, then you're increasing your risk of developing those diseases as you get older. But if we look at the DASH diet in more detail, we've identified some key factors, right? So we know that it's a low sodium diet, and we know that in people with hypertension, a reduction of sodium can actually achieve, between a 7 to an 11 millimeter of mercury reduction in systolic blood pressure, and and we know that that's actually as good as tablets. That's a tablet effect, or the equivalent thereto. But it's not just a reduction in salt in sodium chloride. There's, as you've already mentioned, it's an increase in potassium. So we know that potassium in our diets reduces blood pressure. We know that the average Western diet is deficient in potassium. And so there are specific foods that you've already mentioned that are rich in potassium. So these are the bananas, the cantaloupes, the peaches, the Brussels sprouts, the broccoli, the spinach, the lentils, and things like that. It's also, however, a low-fat, low-red meat diet, isn't it? Would you care to speak about that as well, Saveena?
Yeah, so I guess, and that comes to what we've been going on about every single episode about eating more plant-based food and reducing our red meat consumption. And it comes down to basically having the guidelines on the DASH diet actually recommends 1 to 2 servings a day of low-fat dairy products or red meat. And that's basically what the recommendations are. Essentially, the other thing to also increase, which we talked about previously in the other diets, is also increasing our MUFAs and PUFAs, and that comes down to also our nuts and seed intake. So increasing that to about 2 to 3 times a week also. So lowering your saturated fat and increasing our, MUFAs and PUFAs in our diet. So, when you read about all this and you study about all this, I think the message seems to be quite consistent, isn't it? Would you agree with that, Ferghal? The fact that,
Yeah, you can get really twisted up in the specific details of, am I eating a high MUFA diet or a high PUFA diet with enough stanols or sterols and not enough sodium? And, the bottom line is this, right? A vegetarian, a plant-based whole food diet full of colored vegetables, full of legumes, with minimal saturated fat, minimal red meat, absolutely no processed red meat, oily fish a couple of times a week for the marine omega 3s is probably the best kind of diet that you can do, and it's got so many downstream effects. It always comes back to plants are the vitamin pills. Plants are nature's vitamin pills, and if you want to boost, just eat more plants. There are so many ways that it is beneficial for you. But, we're talking about the DASH diet, and we're talking about, what the point of the DASH diet is, which is basically it's a reduction in blood pressure. And it's the first line dietary intervention that a lot of GPs recommend for hypertension. But we also need to understand it's not something that we can do in isolation, right? If you want to lower your blood pressure, you still have to do everything else. So there are other things that can impact upon blood pressure. So you've talked about low sodium, you've talked about increasing the potassium. We need to exercise more. Exercise reduces blood pressure. We need to drink alcohol in moderation. We know that alcohol actually causes blood pressure. So quitting the booze, or at least regulating the booze to a decent level within national guidelines, is a step towards reducing blood pressure as well. And, stress management. These also have to be taken into account. So it's not just enough to say, oh, you've got hypertension, go on the DASH diet. You don't have to go and exercise and walk the dog and do meditation and Pilates and quit the booze and the fags. Oh, sorry, I forgot to mention cigarettes.
Yeah.
Cigarettes increase blood pressure,
Yeah.
So,
and having adequate sleep.
Having adequate sleep. These are all factors that we need to take into account when we're trying to manage hypertension. So yes, the DASH diet can be the foundation, But to miss out all of the other levels of what people need as an intervention is doing patients a disservice.
I'm just going to play devil's advocate here, but just when you actually do research into the DASH diet itself, it's actually not easy to follow. I think how many of us have time to actually sit and meal prep and count, serves of different things and, try to sort it out in our diet. And I guess that's probably why compliance is actually pretty low with the DASH diet. I think there was, looking at the American population, it was about 1% could actually follow the diet. It's not something that's easy to follow. And, you've got to meal plan and things. It's not easy. So, and I think I'm just taking it back to what you were just saying just now about the whole food, plant-based diet, minimize saturated fat, and, doing all the other lifestyle interventions with it too.
Yeah. So it's useful to know about. But look, if you cannot manage the DASH diet, it's by no means the end of the road in terms of lifestyle interventions. I don't believe, I believe in moderation. I don't believe in extremism of any kind. So therefore, if you can't manage to be completely adherent to the DASH diet, well, pick another diet that works for you. Effectively, the more plants you eat, the less red meat you eat, the lower your blood pressure is going to be. The more exercise you do, the lower your blood pressure is going to be. If you abstain from tobacco smoking, reduce your alcohol, do some meditation, sleep well, the lower your blood pressure is going to be. It's
sounds like a little chant there. But the message is consistent, I guess. Yeah.
So on that sweet note, I think it's time to put the DASH diet to bed, and I look forward to chatting with you again very shortly. Thanks very much, Saveena.
Thanks, Ferghal. See you next time.
That's all for today's Lifestyle Matters. Thanks for watching, and we'll see you next time.